You're listening to the UBC Medicine Learning Network.
From UBC Medicine, this is The Listen, Stories of Virtual Care in Context. I am your host, Dr. Kiran Veerapen. Today, a discussion on professionalism and security. Dr. Brodie Sakakibara and Dr. John Pawlovich joined the Director of Curriculum for the MD undergraduate program, Dr. Adrian Yee, to discuss their approaches to professionalism and security in virtual care.
Welcome, everyone. I'm your host today, Dr. Adrian Yee. So, John, welcome to the podcast. Can you tell us a bit about your clinical practice and how you harness telehealth to improve access for individual that lives in rural and remote community?
Yeah, thanks, Adrian. I'd be pleased to. We started on a journey with my colleagues and the team I work with Carers County Family Services well over a decade ago to integrate technology in a thoughtful relationship-based way to support primary care access. So I'm a family doc, and that's what I know. That's what I do. I've been doing it for almost 30 years. Historically, primary care docs like myself flew into communities, flew out, drove in, drove out, boated in, boated out. And so there'd be long pauses of time with no access to a family doc. And so the whole idea of the technology back in 2011 and even earlier was to create a bridge of access. In other words, how to continue with longitudinal care when I wasn't physically in a community. And so fundamentally, that's what we used technology to achieve in the beginning of our journey with technology and healthcare. And that was to allow for that longitudinal relationship-based care to continue over time.
I can see the virtual care modality is the future. I mean, our province is the size of France, and we are widely distributed across a wide range of area. So what you're doing is really would improve the equitable access across different rural and remote communities. But the digital divide is one of the themes that came up when we conducted our focus group and our interviews with patient partners. And they find it challenging in clinician making assumption of what they can and cannot do. Dr. Sakakibara, in your work, how do you help them to access technology?
Yeah, certainly there's the digital divide, and we can't make assumptions about, access to technology. We talk about the use of virtual rehabilitation to increase access to health services, but, we can't make the assumption that people actually have access to technology. And so in some of the research projects, we've identified, inequities in terms of access to technology. And so whenever possible, we try to make the technology available to our participants or patients. If they don't have the technology to receive the virtual rehab, we provide them with the technology to receive the rehabilitation service.
That seems like the way to go is really proactively helping people, guiding them through how to use that technology. Very grateful that we have 25 patient partners and caregivers participate in our focus group and interviews. What they emphasize is the issue about trust. What is your thought on building trust? And when we have our learner that will soon exit medical school, going into residency, how would you advise them to build trust with patients?
Trust is one of those must-have qualities, entities of a relationship that's just so fundamental in healthcare, both for the provider and for the patient. And oftentimes we think that trust is a commodity that is the product of time. That is, the longer we have shared space and time together, the more we can evolve together in a relationship, the greater the likelihood that trust will emerge between both of us. And that is true. But trust can also be forged in the moment if need be. And I think that's really important, that even a lack of prior relationships, prior interfacing with a healthcare provider or a patient, trust can still be developed in a skillful, thoughtful way within minutes. And that necessitates a healthy dose of humility, of compassion, of caring. I think it's fair to say we all can feel when someone cares about us, when someone is authentically has compassion. So understanding what it means to develop a relationship over time, but also in the moment, will, I think, lead to the development of trust in that moment of time or in that journey, longitudinal journey together.
Yeah, it's an important piece of the puzzle, isn't it? Just reflecting on a project that we have right now called TRAIL, Telerehabilitation with Aims for Lower Extremity Recovery Post-Stroke. It's a progressive exercise and self-management program where participants meet synchronously with a virtual rehabilitation therapist. In this project, we have a few things that we do to help develop trust, really in the areas of pre-enrollment, safety, as well as ongoing check-ins throughout the program. So in terms of pre-enrollment, we have our participants meet with our study coordinator to answer questions about the study and really to ensure that the technology setup is working appropriately. And also we have the participants meet with our therapist in advance of the virtual rehabilitation sessions to ensure that the room setup is appropriate for participants to do exercises and whatnot in their environment. And also as a way for the therapist to meet and greet with the participants and to develop rapport with them prior to going into the virtual rehab sessions. Another way that we try to develop trust is we have a safety protocol. So there's always a safety concern when we're delivering rehabilitation services from a distance. And this is just to make sure that the participant is aware, that if an event happens in any of the sessions, that we've thought it through and that we'll do our best to address the situation from a distance. And so I think, if participants feel as though their safety is in good hands, that might help develop trust with the clinician on the other end. And the third thing that we do is during one session per week, we have our virtual rehab therapist work with participants to develop an exercise action plan that they can do on their own in between the virtual sessions. And during the session, the therapist can debrief with participants on the exercises, and the participants can express their thoughts on the sessions and what they're comfortable with, areas for improvement, and things like this. And I think that this ongoing communication or check-ins is actually quite helpful to develop that rapport and to develop trust in the clinician or healthcare professional. And I guess another thought that comes to mind right now is the more you trust a healthcare provider or a clinician, I think the more likely of a positive health outcome. And so trust is huge, especially when you're delivering something remotely and have to develop rapport remotely.
Yeah, what you said really aligns with what we discover when we engage patient partners. What they tell us is that it takes time to build trust, and it takes really clear communication from both ends and active listening, and also articulating rationale of why you are recommending the intervention. That actually goes a long way to build that relationship. It's very similar to what Dr. Brent O'Hara brought up in episode 3. Trust is the most important. Without trust, people would not take our advice and would not go for the investigation or would not accept therapy. I do have one last question. Privacy and security is very important. How you protect that, and I think that is also a piece of puzzle in terms of building the trust with patient and caregivers.
As a result of the increased interest and use of virtual rehabilitation, practice recommendations for virtual stroke recovery have been developed by an expert group. In these recommendations, there's a section that discusses privacy considerations for virtual rehabilitation. And we've identified a few clinical considerations, 3 of them here, including one having to do with sharing of personal and health information between institutions and virtual rehab clinicians. So the recommendation is basically that institutions should develop protocols to share personal health information that are in accordance with applicable legislation and organizational requirements. And this will allow clinicians to share personal health information about the person with stroke, including electronic health records. Another consideration that's included in these has to do with informed consent for virtual care. And that, such consent should be obtained from the person who's had a stroke or their substitute decision maker, and the consent should be documented before starting. This consent will ensure an understanding of the nature of the virtual rehab program, including awareness of the limitations as well as the risks of virtual care. And third consideration was to have established privacy procedures that should be followed when providing virtual rehab, such as, confirming the patient's identity at the beginning of the virtual encounter and ensuring that the participants in this virtual encounter, so patients and clinicians, they're in appropriate settings where privacy can be ensured.
I take the approach that privacy and security is something that one holistically needs to consider. It's not unique to virtual care. It's not unique to on-the-ground face-to-face care. It's something that needs to be considered under all context of care. And first and foremost, the needs of the patient must take precedence over everything else. What has to happen? What are the conditions under which we're working? Is it this life or death crisis? Is this a conversation that can happen here, or does it need to happen elsewhere? My patients will tell me what is safe for them. There are considerations around the difference between communication, that is what we're doing right now, versus documenting someone's health record in a secure electronic file, or historically we used to use paper charts and so forth. And there are good guidelines around all these things. The Doctors of BC, the College of Family Physicians of Canada, and there are so many resources on the use of technology in healthcare that you could spend days looking through it. But it's interesting when I speak of privacy and security, I often ask people to think about the last time they were in any public or private hospital. I've taken my mother in the last couple of years to the emergency room, for example, and I would say that without question, that is the most unsafe and unprivate experience of her life. Multiple people hear the conversation. Multiple people can read her medical record on the computer screen. It's very undignified. There are many negatives to it. From a virtual health standpoint, I see what we're doing as a huge step forward in meeting people's privacy and security. The last point I'll make is that it really empowers the patients to make choices about where they want to conduct the medical appointment. From the safety of their car, from the safety of their house. They might not be so fortunate to have their own roof over their head. So I've had to do video visits, calls to people in all sorts of different situations in different contexts for patients. And I think what we do is we have the conversation with our patients to help make the right decisions of what feels safe and what feels private, and use common sense to use good technology. And I think that has served certainly myself well, as well as the team around me.
That is really helpful. In my practice, I often offer choices, options for people. I think the principle is to engage people how they would like to be engaged, and also letting them know that you can always swap the interventions or interview in the in-office setting if they prefer. So I find that is actually really helpful to navigate the privacy and security aspect. Do you have any other advice for our learner as they are about to embark on the amazing career in medicine?
Well, I would just offer that they're really moving into an exciting time in history where arguably we've never embraced technology with such vigor as we have today. For that, I'm really grateful. The opportunity to take technology, to use it in a good way, in a powerful way, in a relationship-based way with our patients to help chart a course of healthcare that just unprecedented is really exciting. Hybrid care is the paradigm in which we all find ourselves today, and we will undoubtedly learn along the way. And so with that comes the necessary approach of embracing humility in how we conduct our work. And our patients have helped, my patients have helped me so in such an immense and powerful way over the years to better understand how best to use technology to support them. If you listen to your patients, they have the answers about how best to use this technology to support them. And together, you can do so much. And I just think that the healthcare providers of tomorrow are really moving into a time in history when the power of technology will allow them to do so much more for their patients than ever been experienced before. So I think it's a really exciting time.
It is always humbling for me to meet with a colleague like you that is at the cutting edge and also really doing what you can to improve the equitable access. Thank you. So on behalf of Faculty of Medicine Health Professional Educational Program and also the MD program, I really want to thank you for your time to share your expertise, to share your ideas around virtual care. And we look forward to further conversation in the future. Thank you.
Thanks for having me, Adrian.
Thanks, Adrian.
While virtual care and technology can bridge gaps in care for many patients across our province, providers must prioritize patient privacy and security. Great patient care virtual or in person, is still based on the core tenets of listening, building trust, and providing a safe and accessible care environment. I am Dr. Kiran Veerapen. This has been The Listen.
This has been a presentation of the UBC Medicine Learning Network.